Hello everyone, my name is Philo. I'm a second year medical student, part of the Vassar research team, presenting my project titled Analysis of the Evidence Underpinning the American Academy of Orthopedic Surgeons Knee Osteoarthritis Clinical Practice Guidelines. And so, clinical practice guidelines are a summation of all available literature on a given disease process that offer treatment recommendations reflecting the analysis of that set literature. Therefore, CPGs have wide-reaching implications on patient care, and they provide a unified, evidence-based approach to treatment. However, this makes CPGs and thus patient care reliant on the publication of high-quality, unbiased research. In the literature, CPGs in orthopedic surgery have been critiqued. One study found that only 18% of recommendations are defined as strong and supported by level 1 evidence. Another found that adherence rates to knee osteoarthritis CPGs are as low as 21% in some situations. And other studies have suggested that even the level 1 evidence supporting orthopedic CPGs may be compromised by publication bias, financial conflicts of interest, underpowered conclusions, and low reproducibility. And thus, the objectives of this study are that because CPGs have wide-reaching implications, they should be critically appraised to ensure their recommendations adhere to high-quality standards of reporting. We aim to assess the quality and completeness of RCTs used to support 2 CPGs published by the AAOS, American Academy of Orthopedic Surgeons, for both surgical and non-surgical management of osteoarthritis of the knee. Our hope was to identify gaps in RCT reporting with the goal of bettering the strength of CPG recommendations in orthopedic surgery. For our methodology, we obtained the 2 CPGs from the AAOS's website and screened their reference sections to identify RCTs cited within the guidelines. We performed a power analysis to extract a random sample of RCTs. Then, we evaluated the percent adherence of RCTs according to the Consort 2010 checklist criteria, which is a 25-item checklist that provides guidance for authors when reporting methodology of RCTs. Each RCT was scored based on adherence to each checklist item. 1 point was awarded for full compliance with a given item, half point for partial compliance, and 0 points for non-compliance. In addition, we extracted other study characteristics from each RCT and conducted a multiple regression analysis assessing consort adherence scores against each characteristic. Our sample included 179 RCTs analyzed. The overall adherence score was 68.47% for the 2 CPGs. In addition, items 10, 23, and 24 from the Consort 2010 checklist were the 3 least reported items from the checklist. These specific items focused on adequately reporting methods for randomization and blinding specifically. Also within our study, we found a large number of studies published over a decade ago. 112 of the 179 RCTs were published prior to 2010, and 76 were published prior to 2006. With our multiple regression analysis, we found that studies published after the development of the 2010 Consort checklist had significantly higher adherence scores than those published prior to 2010. We also found that RCTs receiving funding from industry or private sources showed greater complete adherence than RCTs which reported receiving no funding. Finally, studies that included a conflict of interest statement had significantly higher consort adherence scores than those that did not. And so in conclusion, overall we found suboptimal consort adherence for RCTs cited in the AAOS CPGs for management of osteoarthritis of the knee. Based on our findings, we believe that orthopedic guidelines should be updated more frequently than they currently are, given that a significant portion of studies were published over a decade ago, as well as significant increases in consort adherence scores in studies published after 2010. And ultimately, we concluded that CPGs should place greater emphasis on newer RCTs with higher quality reporting to ensure up-to-date, evidence-based clinical decision-making. Here's my contact if you have any questions for me about the project, and here are my references. And thank you so much for your time.